Cade. So I thought it'd be kind of a cool thing for Technique Tuesday to show you a little pediatric technique that I like to use. I see a lot of babies, and which is a good and bad thing, but I love treating little babies and love kind of helping develop them in such an awesome way, impacting them in a very early age. But this is what I call the figure 4 technique. It's not something I've technically seen in a clinic myself or in my studies. It's just something that I kind of thought of. Maybe they're doing it, maybe they're not in other places, but I think it's a really good technique. But basically I'm kind of interlocking my legs in a figure 4 position where I can kind of lock her hips up with my right leg and kind of hook in my foot with my left, right? So you kind of see this figure 4 position with my leg. Now this also frees my hands up to do whatever I want to do. Grab a toy, kind of do some visual scanning. She's trying to reach, she's looking, right? It's awesome, awesome technique. She's using her back muscles to keep herself up, so she's not having to rely on her hands so much, which is very good for posture, very good for body mechanics, very good for her development. And but also too, she's trying to squirm, kind of helps me lock her in here. But basically with Cheyenne, what I want to do is to start promoting independent sitting, promoting more milestones, better milestones. You know, every single month they're trying to kind of promote a new activity. So for her, I want to do independent sitting. So in order to do that, you need to have nice posture, good back muscles to kind of keep yourself upright. So this position, you're kind of having to go fight against gravity to hold yourself up instead of just give in to gravity, right? So this is a very good position. Now, if I want to challenge her even more, this is another good, awesome technique here. Slide my heel, right? And what is she doing at the side? Now, come over here to the side. I want to show you what I'm doing. So you're going from this position, and watch her technique. Watch her back. I'm having to engage her muscles here. And if I take this leg away, what position is she in? She's pretty much in the kneeling position, which is another milestone I want to promote as well, kind of pulling to stand, kind of finding a piece of furniture and pulling up on that piece of furniture to be able to stand up by herself. So you're kind of getting a double whammy in that you're promoting better growth and development of these guys, okay? And you're kind of promoting less tummy time, or less back time, more tummy time, which will help her skull development and all. That's one reason why she's wearing the helmet, is for better skull development, so the skull can form properly and not just be so flat on the back of the head. But yeah, you're just definitely promoting all these milestones and really trying to engage those muscles against gravity, because people don't really think how much gravity plays a role in life. So especially when you don't have a whole bunch of control early on in life, you really kind of give in to gravity. So anyways, I thought this would be a pretty cool technique, something definitely new, something that we do here at Neolife with the majority of my pediatric patients. So I would love for you to, you know, if you see this, if your baby needs something, needs a little bit more promotion of motor milestones, definitely come by, call anytime. I'd love to see you guys.